Fundamentals of evaluation for physical activity and public health are the focus of this module. An area of emphasis is logic modeling and how it can help in laying out an evaluation project for physical activity promotion. A key point is that evaluation efforts should be part of any physical activity promotion program. How else will you know if you have been successful? You may consider the following questions. Why should physical activity programs be evaluated? Does a school district policy that mandates daily physical education classes for elementary school children result in uniform implementation across the district? When should the evaluation of a physical activity promotion program begin? What constitutes success in physical activity programming? In the past 2 weeks, we highlighted effective evidence-based strategies for physical activity promotion. We know that these types of approaches are effective or not because they have been evaluated. Evaluations allow us to make quantifiable conclusions about what a program has been able to change or note and by how much. This module covers fundamental aspects of evaluation and how it is critical for advancing our knowledge of what works in physical activity and public health. The frequently asked question, when should an evaluation of a physical activity promotion project begin? Evaluation plans should be intertwined into all aspects of program planning from the program's inception. If you wait until the project is underway to start thinking about evaluation, you've waited too long. Taking a program reducing risks of fall in a senior center as an example, we would want to know the following: how many adults in the senior center attended the balance exercise classes? How frequently? Were the instructors trained according to the protocols? Were the instructors effective in delivering the program? Were there any injuries? Was the number of falls lower than expected among participants? Was there a dose-response effect? Each of these questions and more addresses a critical aspect of program evaluation. Program evaluation is important for many reasons. First, you want to know whether your program has had the desired effect, therefore, quantification of the effects on participants is important. Second, program evaluations also serve other important functions. For example, a good program evaluation can be used to plan for resources, funding, personnel, and program materials, which can help to ensure overall success. Third, evaluations can also identify program strengths and weaknesses. After all, some things will go right, some will be unexpected, and some will go wrong. If the program was successful, what aspects likely led to the success? What aspects need improvement? In addition, evaluation strategies can also be used in the larger context of public health policy development and implementation. For example, does a new municipal policy designed to increase bicycle use through the construction of bicycle lanes in a certain part of the city actually result in more bicycling? Is there evidence of less motor vehicle traffic in the same area? If there are increases in bicycle lane use and bicycling, when did the increases occur? Are they limited to certain times of the day or days of the week? What are the 6 steps to the CDC's Physical Activity Evaluation Framework? The U.S. Centers for Disease Control and Prevention has proposed a physical activity evaluation framework to help in the development and follow-through of evaluation strategies for physical activity. Program. The framework has 6 crucial steps. 1. Engage stakeholders. 2. Describe and plan the program. 3. Define the evaluation. 4. Gather data. 5. Develop conclusions from the evaluation. 6. Communicate findings to ensure use. What is the definition of the term stakeholders? people and organizations with direct or indirect interests in the project. They can include funding agencies, target populations, policy leaders, and decision makers, project staff, and the evaluation team. Stakeholders should be included in the program and its evaluation early in the process. Although the interest of each stakeholder is unique, engaging all of them at multiple levels is important. This engagement process should involve communication strategies and briefings to ensure that all have an adequate understanding of the project. Evaluation efforts are usually a good meeting ground for project stakeholders because all have a common interest at some or all points along the formative, process, outcome, or cost-effectiveness framework for evaluation. As soon as the program has been defined, thoughts should turn to defining the evaluation. This definition is an interactive process that can result in changes to the program plan. Because the program implementation plan and the evaluation plan inform each other, they should be addressed simultaneously. As shown in the figure, 4 kinds of evaluation strategies are important to physical activity programming. Formative, process, outcome, and cost-effectiveness evaluations are concerned with different types of questions and should be conceptualized accordingly. Formative evaluation is the first level of a physical activity program evaluation. In formative evaluation, the fundamental questions focus on the needs, utility, and design features of a physical activity promotion program or policy and its individual components. Questions asked during the formative evaluation stage do not focus on the outcome, but rather on the overall design of the program. Formative evaluation questions for the Senior Balance Program exercise program discussed earlier may include the following: what is the extent of the problem of falling in the group? How frequently will participants be willing to come to the exercise classes? Will any incentives be needed to increase participation? Is there a leader in the target population who can assist with outreach? What kind of equipment will be needed? How should instructors be trained? Clearly, this information can help the program manager or policy decision maker craft components that will have the best chance of hitting the intended target. What are 2 primary data sources used during formative evaluation? The primary information sources of data during formative evaluation are expert opinion and previous work, and the target population of the program. How does process evaluation differ from formative evaluation? Unlike formative evaluation, process evaluation focuses on program or policy implementation. Of interest is how well the physical activity program or policy is operating and what can be done to improve those operations. Process evaluation helps program managers assess the quality of program or policy delivery. They examine delivery strategies that appear to be successful and those that may not have worked as planned. Both are important not only for evaluating the program or policy, but also for informing future efforts. Process evaluation should include the assessment of delivery alternatives. Using the balance exercise class for seniors example, process evaluation questions may include the following: are all exercise classes being offered as schedules? Is instructor training and certification consistently being offered according to the predetermined protocols? What is the attendance at the classes? How do these data compare to pre-state goals? Are there trends in class attendance over the weeks and months that the program is being offered? Outcome evaluation, often referred to as impact evaluation. Outcome evaluation is also sometimes referred to as impact evaluation because it focuses on cause and effect. Did the program or policy have the intended effect? Outcome evaluation helps answer the question. Did the program or policy increase physical activity behavior? Outcome evaluation seeks to answer this question while also assessing in concert with process and formative evaluation how the intended effects were reached or not. Outcome evaluation metrics for physical activity programs or policies could include minutes per week that the target population engaged in moderate or vigorous intensity physical activity, changes in their physical fitness levels, the percentage of the target population meeting physical activity guidelines, or the number of people using a new bicycle lane. What two considerations can be used to determine the cost-effectiveness of a physical activity intervention? The purpose of a cost-effectiveness evaluation is to assess not only the overall costs of delivery but also how those costs compare with those of alternative program delivery options. Of interest is how the costs of program or policy delivery and implementation compare to costs real or estimated of not delivering the program or policy. In the balance exercise class for senior example, costs of implementation include staff salaries, physical resources, evaluation costs, participation time. These costs are then measured against any medical care expenditures that may be due to the balance exercise program.